So I typically wake up at 5:30 and I go into the bathroom, get ready, show the clip of my little area. So that's the stuff I use to get myself ready, brush my teeth and comb my hair. And then come into my closet, change into some clothes. I don't spend much time because I'm not going to be in them for the most part. Usually I'm in scrubs unless I'm in the office. And then let's go show you what I do. So after I get dressed, I come downstairs. I let the dogs out if they need to be let out, which they often do. And then usually I'll go drink a full cup of water, cold water. And then I'll come over and make my coffee because I always need a little bit of cup of coffee on the way to work. And I usually don't drink it all, but it just makes me feel good. So yeah, I usually make my cup of coffee in the morning, just gets me going. It just kind of the routine I have. So it takes a few minutes to do that. Put my coffee into a travel cup to go. Typically, I leave the house around 6 o'clock. It depends, how many patients I have in the hospital around on before I get to, to surgery or the office. But today's a Saturday, so I'm going in a little bit later. But it takes me to this hospital we're going to, which is the hospital I operated the most, takes me about 10 minutes to get there. And then, Jenny usually meets me there. And then we'll round on our patients in the hospital. Sometimes we have 2, sometimes we have 4 or 5. And, that's a typical day when I'm not on call. If I'm on trauma call, it's different because I'm at another hospital seeing all the trauma patients. So this is my elective week that I'm doing right now. All right, so I just got to the hospital, getting ready to go around on the patients. So just walking through the parking lot. Parking lot's kind of empty this morning. It's usually full, but it's a Saturday morning. There's not as many doctors here today. So coming in the doctor's entrance here. All right, so we're gonna come over to where my patients typically are. I just finished seeing my patients and I put my coat back on, I had it off when I was seeing the patients, but then now we're gonna walk over to the pre-anesthesia area and I'll show you where I see patients before surgery, all right? This is typically where I would see a patient and their family before surgery and talk to them, right here. And then this is the recovery room, so it's where our patients come after surgery. If they're outpatient, they'll stay for an hour or 2, or if they're inpatient, usually they'll stay an hour or 2 and they go to their rooms. I think today I'll probably just relax a little bit. We'll have a nice family dinner. I think we're cooking a spaghetti dinner. And maybe we had a little bit of snow. Archie was only a few months old when we had snow last year, so maybe we'll get him out there in the snow since he's walking now.